Hello viewers, this is Dr. Sangeeta Datta, consultant psychiatrist, and today we shall discuss about perimenopausal syndrome or PMS. Perimenopausal syndrome is a very common entity which most women, when they go through their menopause, also suffer from this. A lot of women, when they're approaching menopause, about 2 to 3 years before they actually have menopause, start having these symptoms, and it continues throughout menopause, and it lasts for about 1 or 2 years after menopause. Usually, most women can deal with these symptoms by herself, but sometimes coming to see a mental health professional becomes very important because they cannot manage their symptoms by themselves. The commonly seen symptoms in perimenopausal syndrome are sleep disturbances and night sweats. In other words, this lady wakes up in the middle of the night sweating and not getting sleep again, and it becomes very difficult for her to fall asleep again. Apart from that, there can be body aches and pains, there can be mood swings and irritability, and there can be low mood or depression too. And the person feels fatigue most of the time, and she starts living a life and effort. All the things that she used to do very easily earlier now becomes an effort. She also has emotional lability, which means that she becomes hypersensitive to everything and can cry on the slightest pretext or get angry on the slightest pretext. If you have any family member whose menstrual cycle is becoming irregular, or she is in her mid-40s, maybe she is 43, 44 years of age, and she has recently changed her personality and has developed all these symptoms that I just now mentioned, she could be suffering from perimenopausal syndrome. Sometimes these symptoms can be so severe that a clear-cut episode of depression also sets in. When we as mental health professionals get to see such a client, we start counseling her, teach her about the hormonal imbalance that is going on in her body. Estrogen, the female hormone, decreases drastically at around this time, and she, because of lack of estrogen, there are mood swings and all the other symptoms. And it takes at least a few years for her to stabilize with a new level of hormones, which are much lesser. Estrogen is much lesser as compared to her youthful days. We usually give psychoeducation to these clients. We tell her what is happening to her hormones, her body and her mind. And a lot of women who come to know about the actual changes happening to them in life and in their bodies and in their hormones can cope better. We also teach them healthy lifestyle techniques, teaching them how to live a healthy lifestyle with eating nutritious food, getting proper sleep at least 7 to 8 hours every night, getting proper exercise every day, and also doing some kind of mental relaxation, resorting to some kind of mental relaxation technique like yoga and meditation goes far to control these symptoms. However, some women who are going through this phase will also need medications apart from counseling. Family support is very important for these women, because we see that in case of women where family support is very strong, spouses are very understanding, children are very nurturing, in those cases women cope better and they don't have severe symptoms. So there is a psychological part to it. Therefore, all of you have to remember and understand that our mothers used to take care of us ever since we were born, and much before we were born also. So now it's time that we take care of them. They are going through a transition in life which is called menopause, and it's not easy for them. To keep them healthy, to keep them occupied, and to keep them positive and happy should be our goal. That way we'll be able to help them cope with what is very naturally happening to them. In other cases, take them to a mental health professional so that they can get treated. Some clients also go to gynecologists and they get some hormonal treatment for this phase when it's very severe. However, we try through non-hormonal treatments so that they can cope better. And this video will definitely succeed in increasing awareness about perimenopausal syndrome and to make the lives of all these women, middle-aged women, much better, healthier and happier. Do remember to like this video or subscribe this video, and we promise to come back with another interesting topic. Till then, take care.